This station tests the EMT candidate's ability to use a bag valve mask effectively to ventilate an apneic patient. In this station, the candidate will perform both 1 and 2 rescuer BVM ventilation. A second EMT will arrive to assist with 2 rescuer BVM ventilation. This station should take approximately 5 minutes to complete.
Any apneic patient needs to receive effective ventilation with a BVM and supplemental oxygen. Maintaining a good mask seal and providing proper ventilatory volume and rate are necessary to be successful at this station.
Candidates at this station will have the equipment, supplies, and additional personnel necessary to effectively ventilate an apneic patient. Equipment and supplies for use at this station include an airway mannequin, bag valve device with masks of various size, supplemental oxygen, airway adjuncts, and medical exam gloves. The main sections of this station involve airway management, proper mask selection and seal, 1 rescuer BVM technique, and 2 rescuer BVM technique.
You have an apneic patient that has no risk of C-spine injury. You've already examined your equipment, so go ahead and start when you're ready.
Begin the station by indicating that the proper personal protective equipment is being used.
Take proper body substance isolation precautions with gloves, mask, and eye protection.
While positioned at the head of the patient, verbalize opening the airway and inserting an airway adjunct such as an OPA.
Open the airway. Select the appropriate sized airway. This one appears to fit.
It is important to select an appropriately sized mask and to create a proper seal on the face of the mannequin.
Select the appropriate size mask.
With the airway open and the mask properly applied to the face, begin ventilating the mannequin. Note the proper expansion of the lungs, indicating adequate volume. Attach the reservoir to supplemental oxygen and adjust the liter flow to at least 15 liters per minute. Once the initial ventilations have been provided and the BVM attached to supplemental oxygen, a second rescuer will become available to ventilate the mannequin using a 2 rescuer BVM technique. Resume ventilations at the proper volume and rate.
Here's a second EMT to assist you.
Hey, John, let me give you a hand there.
With the scenario complete, the examiner checks the candidate's performance against the critical criteria for the station. The items at this station that would result in failure include failing to take or verbalize the use of body substance isolation precautions, failing to immediately ventilate the apneic patient, interrupting ventilations for more than 20 seconds, failing to provide a high concentration of supplemental oxygen, failing to provide or direct the second rescuer to provide proper volume, and failing to allow for adequate exhalation. Provide ventilations at a rate of 15 to 20 breaths per minute.
To be successful at this station, remember to maintain an open airway, good mask seal, and proper ventilation rate and volume. Attach the BVM to supplemental oxygen.